Welcome back to CTRL News. I am Mondli Sogo. Today, we are looking at the effect of HIV and AIDS on South Africa after American President Donald Trump pulled the aid that was actually used to actually manage HIV and AIDS in South Africa. And please do subscribe and interact with us in the comment section. I would really love to know what you think about the stories that we bring to you on this show. HIV and AIDS is no laughing matter. Earlier on in the 90s in South Africa, it actually unalived quite a whole lot of people. And it was one of those things that South Africa has spent its budget and it's monitored very, very closely. Hence, even Americans had to come in with their aid to help in terms of managing the situation and just making sure that South Africans find a way around HIV and AIDS. Unfortunately, this is what I would love you to have a listen to for now before we proceed.
My message to Donald Trump, please help us. Please just give us medication. We still want to survive.
This is Tiny. He's a gay man living with HIV in South Africa.
My biggest fear is for now, so many people, they're in danger. And I'm scared that so many people will can die without medication.
Tiny was relying on a US aid-funded clinic for HIV treatment before it was shut down by President Trump.
If you go to the government clinics, there's a lot of gossiping, especially if you are gay or if you are trans or if you are gay. Believe me, you won't survive.
The South African government has stepped in to provide services, but anti-LGBTQ stigma is getting in the way of care.
It's one thing to give a financial aid towards helping people to get back into care. It's a completely other thing to provide a safe space for people to actually feel comfortable coming in, feel comfortable disclosing everything that is affecting their health and their risk status.
And I see what I guess was a US aid sign advertising services is now just been reduced to a tablecloth.
Once it was a flag flying high, actually a proud call for people to come on through. And well, now the reality is what it is.
You have had it. So that is part of the problem. So there were some patients that were on medication, HIV medication, and they were less infectious to others because they were on medication. So now that they are out of medication, it won't take long before they actually are infectious, and it's definitely going to affect everybody else. They are not the only group that couldn't find medication in clinic. They are in clinics. There is also another group that has been prevented by Operation Tudula from accessing medical care in public clinics. So the real reason why they go to public clinics to begin with is because they cannot afford medical care on private institutions. So what happens if they cannot access medication, and whom exactly do we think they will be mingling with? They will be mingling around with everybody. So it actually increases. So we are highly likely to see a high spike of HIV infections in South Africa. It was not just in Gauteng, but in different parts of the country, people are actually short of medication, especially in terms of HIV. And also, this was an interview from Radio 702. Have a listen.
Highly dependent on foreign aid for their treatment program. And they would have. We sent a journalist to Mozambique who reported back on how the program has pretty much collapsed as a result of the cut in aid.
One of the things that has emerged, Nathan, is the difficulty for some sectors of our population in terms of accessing treatment. HIV-positive workers, for example, there are some anecdotal stories around being turned away from government clinics. I heard of an example of a transgender woman who was told she couldn't get PrEP, for example, pre-exposure prophylaxis. She says it's because she was told at a public clinic that that's only for people in partnerships with somebody who has HIV trying to have babies. There are many other examples anecdotally where these issues have become a challenge and people are now accessing treatment from the black market.
Yeah, so one of the things that the US government was funding were clinics in Johannesburg that were run by a Wits University Institute. And they specifically aimed at catering for transgender people. And it's those populations, those particularly vulnerable people that would have been harmed by the withdrawal of the aid and of the USA. So the example you give goes right to the heart of the matter.
And also, of course, as you say, the loss of counselors who used to do these rapid diagnostic tests, many pregnant women not quite being able to get on preventative drugs because, of course, counselors were part of that process. So it really has affected many sectors of our community. Now, with South Africa having the highest number of infections of any country in the world, what does that mean?
Well, it means that, first of all, people who are lost to care are likely going to become ill. Many of them will die. And what's more is that they will, because some of them would have been, or most of them would have been on antiretroviral treatment, and therefore the virus in their blood would have been suppressed, and therefore they would have not been infectious. They will now become infectious again. So we could see an uptick in the number of in our HIV incidents and the number of new HIV cases as well. But look, it's not entirely disastrous. The program has held together. The vast majority of people on treatment remain on treatment, but there are clearly problems. And by denying them, by saying that everything's okay, we don't do ourselves any favors. It was obviously going to be very difficult once the US government withdrew aid.
Yeah.
And it would have been much better if the Ministry of Health had simply acknowledged that and said, look, we're going to look into what's going on. We're going to try and find the money to replace it. But obviously, this is going to be a hit to our program. That would have been the honest way.
Therein lies the rub, Nathan, because then finding the money means you have to do something about it. If nothing changes, what does the next 12 months look like for the program?
Well, hopefully we can recover over the next 12 months. As I said, the lottery is putting money into the program. Government can direct more money to the program through the budget. But of course, numerous competing things for the budget in South Africa, numerous competing essential services. So that's going to have to be a debate that takes place over the next as the budget is finalized. Hopefully, we can see the program completely recover over the next year, but it's not going to happen magically. Steps have to be taken to make sure it does. And we have to try and ensure that these facilities that were treating very vulnerable people are in some way or another supported or reopened.
Is there a particular demographic you're worried about in terms of age or section of the population where you are seeing new infections?
So I think the people who are most I'm speculating and I'm probably going beyond my area of knowledge, but I would imagine that the people who are most affected by this would be sex workers, particularly sex workers and some sections of the gay community, trans people. Those would be the people who would most likely be falling off treatment as a result of this. But not only that, as you point out, with the loss of counselors that were funded by the US government, many other people who don't fit into those categories would also not be getting the kind of care that they need.
And we still live with 8 million infected people in South Africa, 1 in every 5 adults. Nathan Geffen, Ground Up Editor, appreciate your time.
There's been developments, though. Since then, China has came forward offering South Africa $3.5 million in terms of fighting HIV. So this budget is supposed to go towards HIV prevention, among other things. Remember who is concerned about China's influence in Africa? The Americans. And exactly who pulled out the aid? Americans. Have a listen.
Mr. President, on pre-social, you said that you were going to cut aid from South Africa. Will you plan to cut aid across other African nations, and Why South
No,
Africa?
it's only South Africa. Terrible things are happening in South Africa. The leadership is doing some terrible things, horrible things. So that's under investigation right now. We'll make a determination. And until such time as we find out what South Africa is doing, they're taking away land, they're confiscating land, and actually they're doing things that are perhaps far worse than that.
And on the Fed Chair Jerome Powell, he held rates. What's your reaction to him not changing the rates?
What did you say?
Fed Chair Jerome Powell, the Fed meeting was this week. He held the rates. He didn't cut the.
So I'm not surprised. I think holding the rates at this point was the right thing to do.
Mr. President, which country will be next on tariffs? Would you consider taxing the UK, for example?
Well, we're going to see what happens. It'll happen, but we're going to see how things work out. It might happen with them, but it will definitely happen with the European Union. I can tell you that, because they've really taken advantage of us. And you know, we have over a $300 billion deficit. They don't take our cars. They don't take our farm products. They take almost nothing. And we take everything from them, millions of cars, tremendous amounts of food and farm products. So the UK is way out of line, and we'll see. The UK, but European Union is really out of line. UK is out of line, but I'm sure I think that one can be worked out. But the European Union it's an atrocity, what they've done. Well, Prime Minister Starmer has been very nice. We've had a couple of meetings. We've had numerous phone calls. We're getting along very well. We'll see whether or not we can balance out our budget. With the European Union, it's a $350 billion deficit. So obviously something's going to take place there. Where?
25%?
With who? With who? I wouldn't say there's a timeline, but it's going to be pretty soon. No, I'm not concerned. We may have short-term some little pain, and people understand that. But long-term, the United States has been ripped off by virtually every country in the world. We have deficits with almost every country. Not every country, but almost. And we're going to change it. It's been unfair. That's why we owe $36 trillion. We have deficits with everybody. We help everybody. We've been helping everybody for years. And to be honest, I don't think they appreciate it. So we're going to change that. We're going to change it fast. We're going to make America great again. We have to focus on our country. We have tremendous potential if properly used, and we have to focus on our country. Tremendous deficits with China, tremendous deficits with the European Union, tremendous deficits with Mexico and Canada. And why? What's the purpose of that? Why would we have deficits? And you look at, if you look at pharmaceuticals and drugs, if you look at various products, it's much cheaper in other countries. We're not going to allow that much longer. We're not going to take it.
So, America is concerned about China's influence in Africa. Yet they are not helping Africans in any way because they are withdrawing funds, not because of anything quite reasonable to say, okay, we ourselves have actually run short of funds or whatever valid reason. The way the aid was actually withdrawn, it was not in a respectful way. It was just pulled out. It was just Donald Trump throwing tantrums. So now China is stepping forward. By the way, China is no stranger to Africans. China is building roads. China is building schools. China is giving bursaries to Africans to study in their Chinese universities who actually come back to Africa and actually invest those skills in terms of improving certain countries. So now look at the difference between America and China. If America give you aid, you should comply with some of their ideologies. And China will either donate or will either give you a loan. Two countries who actually come to Africa looking for influence in Africa, but with different intentions. China doesn't necessarily tell you what you should do politically in your country. If they give you a loan, they just give you a loan. If it's an aid, it's a donation, it's just a donation. Americans have very ugly names for countries that actually do what is best for their countries and for their people. They will say things like you are anti-American, or you are threatening or undermining American interests, forgetting that every other country has a responsibility to take care of its own people. So BRICS is one of those reasons. It is said to be undermining American interests. While no one is undermining any American interests, everyone is doing what is best for their people. You are trying to tell me that there isn't any poor people in China? Of course they are there. But Chinese have treated Africans way better than any other colonizer have treated Africans. South Africa's case is a bit different to other African countries. Reason being, on the later years, South Africa had the Afrikaners running South Africa under the flag of apartheid. Under the flag of apartheid, they actually built infrastructure in South Africa because they believe that they are not going anywhere. They are going to be here for a very long time. However, in other African countries, the colonizers to those countries never built infrastructure for the good of those countries. They just built roads from the mine, either to the seaport or to the airport, and then that could be it, and probably houses and electricity where them and their staff members will stay. But they never did it in the best interest of those countries. So South African case is very unique because in South Africa, the Afrikaner community was building infrastructure, believing that they will be here. So they were building infrastructure that was meant to last, unlike other African countries. So when it comes to other African countries, when China came, donating money to build dams, to build roads, it was the best offer that those African countries have ever seen. So hence why some of the countries actually have a very big appetite for anything that China is offering versus what the Americans are offering versus what the West is actually offering. So in this case of aid, America was giving 400 million US dollars in aid, which was helping paying salaries for counselors, which was actually helping in terms of buying test kits, the medication itself, among many other things. So with the withdrawal of that aid, it has left a very huge vacuum. It is just Donald Trump said to be making America great again. This is one of the videos that actually shocked the world of Donald Trump talking about Lesotho. Listen.
$5 million for diversity, equity, and inclusion scholarships in Burma. $40 million to improve the social and economic inclusion of sedentary migrants. Nobody knows what that is. $8 million to promote LGBTQI+ in the African nation of Lesotho, which nobody has ever heard of. $60 million for indigenous peoples and Afro-Colombian empowerment in Central America. $60 million. $8 million for making mice transgender. This is real.
Lesotho is no unique case. In Mozambique, the whole system in terms of what the foreign aid was offering has totally collapsed, as we have heard in that soundbite from 702. It has totally collapsed. Tell me about it. A whole African nation that relied on foreign aid in terms of combating HIV now is back to square one without that aid. In South Africa, well, I understand the minister tried to downplay it, and we had local companies trying to actually put some weight into it, but the impact is just not the same. And this is an impact that South Africans are still going to feel for a very long time until a permanent solution is actually reached. I am Mondle Sogo. Please do subscribe and interact with us in the comment section.